Hello and welcome. I am Jennifer Jabbar. On today's special program, we'll be bringing focus and attention to two very important issues affecting our community here in Queens, New York. First, we'll be talking about the issue of mental health. Now, on October 11th, we saw a 23-year-old mother had just given birth to a baby boy, and as she told the court hearing, she panicked and she threw her baby out of the window. Now, this program is not to pass judgment on that young lady, but to bring focus and attention to mental health issue, and it's really to provide information that is very much needed in our community. And my background as well is public health. I have a master's in public health and focus on the behavioral sciences. Now, mental health talks about the social, emotional, and psychological well-being of a person. And if a person's mental health is not at the state that it should be, it affects their overall health, their overall well-being. So that's why we need to focus on mental health, and because mental health is also behavioral health, because it really affects the way we act, we think, and we feel. So this is why we're going to be talking about mental health, and also because mental health issues affect 1 in 5 Americans. 18.5% of our population suffer from a mental health illness. And so joining me on today's program is District Leader for the New York State Assembly for District 31, Richard David. Now, Richard David has been very active in this community. Since I've met Richard, I've done several interviews with him, and I follow him on social media. He's always outspoken and always trying to bring representation to people who have never really had representation before. He's always encouraging the community, and this is a problem in our community where we're not really going out to vote. If we don't go out to vote, we cannot bring someone like Richard David, who knows this community, who knows politics, who knows how government works, to bring that representation to the community. So Richard and I will be talking about this mental health issue, as well as the elections that are just a few days away. And an election you can actually vote in actually starts today. So Richard, thank you so much for coming on the show today. Tell me, first of all, what's happening down on the ground in the community as it relates to the mental health issue. Let's begin with that.
Good morning, and I'm really glad to learn. I know that you have a mental health background and a public health background.
Yeah.
And there are so many people in our community who are actually licensed social workers who are, they have MPHs. They're really clinical workers. We have a wealth of trained individuals, professionals who are in this field. Now, I'm wearing purple today. I don't know if you're able to tell because October is Domestic Violence Awareness Month. And the latest case with the young woman who had this tragedy with her child, it's become a media case. And, I've heard things like, how does this make our community look? People have said terrible things about her. People have said things about her state of mind. As a community, we have a historic opportunity here, an unfortunate opportunity to ask ourselves, where do we want to go? And do we believe that this case was avoidable? And, I say it's a media case because there are so many cases like, not as bad as this, but there are other heinous crimes that have occurred. Men have chopped their wives. Domestic violence reports in Richmond Hill are among the highest anywhere in New York State and anywhere in the country. Children get separated from their parents. Indo-Caribbean children get separated from their parents regularly. Suicide is not just in Berbice and Guyana. It's also here in Queens. And so we have this tragedy that we can turn into an opportunity. And we can ask ourselves, is there a common threat? And what do we do about it? Now, I think a lot of people understand, we're New Yorkers. I think we have a pretty good sense of what mental health issues are on a surface level. And New Yorkers, and I would put us in that category, are beginning to peel the onion back and learn more about how deep rooted mental health issues are and getting comfortable talking about it and actually dealing with it in a culturally appropriate way. You know, we don't really talk about all the issues that affect us in our families, but we have other ways of coping and dealing with it. Not everything is broadcast and public, and we don't always speak out and shame. We have different cultural ways that we've dealt with it. We got to figure out how we're going to deal with this. Now, here's my recommendation. We have a lot of organizations that have the best intentions and are working really hard to bring resources to this community. You have activists like myself and politicians and others who want to help us. But what is it that we want? What are we asking for? And are we asking the right people? For example, our council member here is Adrienne Adams. Adrienne Adams represents Council District 28 in Richmond Hill and South Ozone Park. Councilmember Adams should open an office in Richmond Hill on Liberty Avenue because she said that that's something that she would do in her re-election campaign. But she needs to hear from our community. Have people called Councilmember Adams to talk about how we can come up with solutions for this community. Now, I'm raising that as an issue because we need all the stakeholders involved. We need our government to be involved, and we need our elected officials to be involved. And I found Councilmember Adams, for example, to be very engaged, but she doesn't really hear from our community. We're not calling her office phone a lot. We're not telling her that we want her to be at the table with us, and we're not bringing solutions like maybe we should work with the Department of Health or ACS, where I used to work. I used to be the chief of staff at ACS, to develop a special contract that focuses on the mental health of Indo-Caribbeans in New York. And that contract would go to a local-based organization. So a lot of the people who are social workers and clinical professionals can serve this community with a cultural competence.
So, Richard, do you think that this is a taboo subject and it's not talked about enough, and we need to talk about it more in our homes, in our families?
Yeah, but it's not just talking about it. We need tools to talk about it. We need to know how to bring up the conversation. We need to know what ways we have to negotiate and navigate conflict. We got to be okay embracing conflict, but we don't always have the tools to deal with uncomfortable situations. You know, I know a lot of partners, men, women, same-sex couples in our community who, if an issue comes up, the man drinks too much and he comes home, and you know, Guyanese men become a different person sometimes when they drink, and it causes conflict in the home. We don't always have the tools to deal with that, and to navigate it. So it sometimes ends in quarreling and fighting and unhappiness. In the worst cases, it ends in violence and just turmoil, divorces, separation, those kinds of things. Mm-hmm. So we can always talk more and do more. I'm calling on the state, and I'm calling on the people that are watching your show to reach out to your elected officials to give money to Indo-Caribbean organizations so they have people that know us. They speak our language. They understand that we don't discuss and talk about everything openly, and there's nothing wrong with that. There's a time and place for everything, but there are organizations that are Guyanese run or Trinidadian run who understand this, and we can develop tools that are unique to this community, and we can meet this community where it's at. People don't want these outcomes. We're heartbroken. We're shocked by these tragedies, and you know, it's a good thing that we're shocked, because when we're not shocked anymore, that's when it becomes normal. We are shocked and shaken when we see these headlines and we're sharing it on social media because it's unusual, because we want answers, because we're a community that's always looking to help.
How do you think the dynamics of living in New York and having to deal with everything of being an immigrant, trying to become successful in New York, having other people who are, you're looking at other families, you see they're succeeding, maybe you're not at that level, and looking at all these dynamics, whether it's education, whether it's job wise, all the status that comes with living in New York. How do you think those dynamics play a part in our mental health?
Thank you for that question. I think anywhere you live, whether it's Guyana or here in New York, there are different challenges. And it's really hard to live in New York, especially now during COVID-19, because if you're undocumented, you probably don't have a stable stream of income. You might even be having some tension with your landlord because it's hard to pay the rent. There might be tension in the household for anyone because you're spending so much time together. You don't have that escape anymore. We're seeing that, I have a friend who is a liquor and beer distributor. He said business has never been as good as it is right now. And
Wow.
it's okay for people to drink a little bit at home, but the health consequences that we're going to face coming out of this are significant. The physical, medical health conditions. We're a community that doesn't just have to confront mental health challenges. We have diabetes and high blood pressure and obesity and a series of things. And our diet, our food is a lot of carbs and it's very unhealthy. And we're eating it more than ever eating it at home. So we're going to come out of this with some really big challenges. Life in New York, though, is difficult for many reasons. Beyond this pandemic. I'll give you a perfect example. In Guyana, when I was growing up, and the cases that I hear, I'm from Myconian, a small village. A good man, a good husband, a good father was one who went to work and brought his money home, and he didn't drink it out at the rum shop before reaching house. He didn't have to spend time with his wife. He didn't have to spend time with his kids. He was a provider. He was a good man if he just went to work and brought his money home. In New York, that's not enough. A good man, a good husband, a good father. It doesn't matter if he works almost. It's important that he does, but does he spend time with the kids? Does he spend time with his wife? Do they do activities together? That's what in New York is considered a good man or a good husband. And the same can be said for women as well. And so there are a lot of cultural differences that are very challenging to adjust to, that we're beginning to assimilate and dealing with. But the Guyanese community, the truth is the Guyanese community has lived in Queens and in New York since the 1960s. There are probably more Guyanese in New York that are born in the United States than maybe even in Guyana. There are so many Guyanese that are born here, second, third generation. And so these issues are not Guyanese issues anymore. They're Guyanese American issues. They're Indo-Caribbean issues. And the culture is still there. And we're part of a really incredible culture. I wish we had the tools to deal with some of these challenges that we're facing.
How do you think COVID-19 has impacted the community as well? I know you touched on it, but we've seen that divorce rates went up across the country because of COVID. And also we've seen a rise in mental health. So how do you think the entire lockdown and everything that we went through since March has played a part right now?
Unfortunately, I think the worst is yet to come. I think that a lot of people are coping and finding ways to get by, but a lot of kids are being abused at home. And look, I don't mean, you give them like a little smack here and there, Caribbean. Serious abuse is happening. Sexual molestation of young kids is happening. And those cases aren't getting reported with the level of frequency that was happening before. Domestic violence is at a higher rate. Conflict is at a higher rate than it was. And, it's a struggle to get by. There is a significant degree of uncertainty. They just put a large part of Richmond Hill and South Ozone Park, which is the heart of the Indo-Caribbean community, in COVID as a COVID yellow zone because of increased cases of increased positive cases of COVID. And as we move into this religious season, for Hindus, we're celebrating Navratri. For Christian communities, we're going to move into the Christmas holidays and Thanksgiving. And as we go into this, family and friend period, the cases are going to increase and it's going to get worse, and the strain on families is going to be more. But I said the worst, I think, is yet to come, because I think that the health challenges, second pandemic, isn't what we're experiencing now. It's going to be the lack of exercise and the kinds of food that we're eating, the alcohol we're consuming now to cope with this. We're going to have to deal with that after. And our hospitals in Queens are among the worst in the country. They're not, I don't know how they compare to Guyana, but don't be fooled that we have good healthcare here in New York City, Queens. We have terrible healthcare here in New York City and in Queens. And these are the hospitals that we're going to have to go to.
So how do you plan to bring more? I mean, if we don't vote for you, if our community don't come out to vote for you, I mean, you won't be able to bring representation to this community. So what can we do? How are we going to, even with the census, we saw there's been a low turnout with the census. People don't feel that, they need to be counted. And I don't know, I'm not sure if that's even accurate, because people in Guyana, they're from Guyana. They know that when you vote in Guyana, your vote counts and why you need to vote. So why is it here in New York, you feel that you don't need to vote, your vote doesn't matter, you don't need to fill your census, it doesn't matter? I just don't get it.
I'm smiling.
But I can understand your challenge, and I can understand, your struggles to get this message to the community.
I'm smiling, Jennifer, because I'm still a little heartbroken. I recently ran for office, and I didn't win, and I came in second. I lost by a few hundred votes. The winner got a total of about 4,000 votes, which is really not a lot. And I'm smiling because it's my way of dealing with the heartbreak. I'm heartbroken. I really thought that the community would come out and we would win this election, and more and more people are voting and participating. We see that in the numbers. But when I see a candidate winning an election by 4,000 votes, and I know that our community is so large, it's a little bit disappointing. It feels like a setback. And in that election, for the first time ever, the Democratic Party in Queens endorsed a Guyanese Indian candidate. They endorsed me. That's never happened. And they said to me, "Now you got to get your community to come out. They got to have your back." And I'm worried about what this means. I don't know if it'll happen again, because maybe they'll say, "Well, we tried and it didn't work." And I continue to be hopeful, though. I continue to be optimistic that maybe I'm not the right candidate, but I want to see other candidates run. I think that we have a lot of leaders in our community, especially a lot of really bright young people who are growing up here, who will get involved in politics. And I'm lucky that I'm not the only one that's talking about voting and the census and getting involved. We are surrounded by people who are sending out similar messages. And so the census rate went up. It's about the same as it was in 2010. And so despite COVID and other challenges, it was high, but we're getting good information from these things as well. We learned that the Guyanese community is the second largest immigrant group, foreign-born group in Queens. That's huge. And it should shock you that we don't have an elected official from this community here in Queens. But I think that political participation is going to continue to grow, and voting starts today, for example. And you can go, if you live in South Ozone Park or Richmond Hill, you can go to the casino any day this week or next week and go to vote. The last day to vote is November 3rd. And so you should just get it out the way. Go on the weekend, drive over, park in the parking lot, and vote. And I should also say a lot of people did vote for me, and I'm incredibly thankful for the people who did vote. And you know, I continue to do what I can to mobilize this community and to bring services here, but I can't do it alone.
Mm-hmm. Why do you think this election is one of the most important in our history?
When Donald Trump got elected to public office, I've talked about coming to the United States undocumented, backtrack. A lot of guys come here backtrack. And so I have a special place in my heart, in my mind for people who are living here in fear or just undocumented because of the circumstances that they found themselves in. When Donald Trump got elected, he said that he would pass comprehensive immigration reform, or at a minimum, he would help the dreamers. These are young people who came here. They were brought by their parents, and they've grown up here. They've only lived here. The United States is home. And he promised to help this community, and he abandoned them. And I remember, and that's important because, you know, I didn't realize that Guyanese were the largest users of this specific program to come to the country. And so we were the most affected by it. And when Donald Trump got elected, you know, I think it was a bit shocking. I was supporting Hillary Clinton. And regardless of that, I remember things that I had never heard of before began happening. I remember I got calls to go to roti shops in the middle of the night to talk to the workers, to reassure them that ICE isn't going to show up and arrest them for doing nothing, bailing roti and cooking. That they can send their kids to school because ICE isn't going to be in the school to lock their kids up and separate them the way they've been separating kids from their parents on the southern border. Now, I know that people should come here illegally and follow the rules. I wish it was that simple for everyone. I want a president who is more sympathetic to immigrant communities. Now, if you're watching this, you will probably say to me, Barack Obama deported more immigrants and undocumented people than any president in history. And that would be true. Mm-hmm. And that was wrong too. And although it was more humane and it wasn't as public and dehumanizing as this president has made it, we should be calling for a president who will treat this community fairly. If people have to go back, send them back. But don't separate people from their children. Don't dehumanize them. And give a path to legalization. Give a path to citizenship. Mm-hmm. That's what we need. And these are hardworking Americans. And I know that because when I walk down Liberty Avenue, these roti shops are thriving. Liberty Avenue is thriving because of the hardworking immigrant Indo-Caribbean community here in Richmond Hill and in South Ozone Park. So this election is incredibly important. And now I'm not worried about New York. I think we'll do fine. I'm worried about Florida. I'm worried about Pennsylvania, where I know that there are large Guyanese communities as well. And I'm encouraging them to vote and to vote blue.
Mm-hmm. How do you feel about the possibility of having the first female vice president of color?
Look, it's long overdue. Even Guyana has elected a woman, or Guyana has had a woman as president. Trinidad had Auntie Kamala. And so I'm excited that we'll have Auntie Kamala here in the White House too.
Mm-hmm. All right, Richard, I want to thank you so much for coming on the show today to sharing your thoughts on very pertinent and important issues affecting our community here in Queens, New York.
Thank you, Jennifer. And thank you for spotlighting this. What I'll say is, look, maybe we haven't touched on something that's affecting you at home and you're watching this. If you need help, reach out to me. I'm incredibly accessible on social media. Just message. I'll do my best to help. And it doesn't have to just be me. Reach out to your elected officials. They are here for you. They represent this community. And so ask them for help and they will respond to you. But if they're not hearing from you and all your requests are only coming to me, they will think that we don't exist. They will think that there aren't Guyanese and Trinidadian people who live in Richmond Hill anymore, that we only exist on social media. And so make your voices be heard, send your complaints to the right authorities, and get help if you need help. We're in the United States. There's a lot of assistance here for you.
All right, Richard. There you had Richard David, who is district leader for the New York State Assembly for District 31. And as Richard said, he's encouraging you, if you have any issues or concerns that need to be addressed, you can contact him or your representative official. And this Richard has been very active in the community, as you would know, and is always encouraging you to submit those concerns and questions, and will always be there for us in the community to bring that representation that is so needed in Queens, New York. I'm Jennifer Jabbar. Thank you for watching.